On this episode of the podcast, I am joined by physical therapist Dr. Jonathan Amato. Dr. Amato is a physical therapist out of New York, and he works at Bethpage Physical Therapy. He joins me on the podcast today to discuss the treatment strategies that he uses, the techniques that he found most effective to treating high-level athletes, as he is a guy that treats a good number of high-level grapplers and UFC fighters in the New York area. So thank you to Jonathan Amato for joining me on the podcast. Also, thank you to my sponsor, Defense Soap. Check them out at defensesoap.com for all your skincare needs to help you keep your skin healthy from training and on the mats. And also, guys, if you're in the Louisville area and you want to work with me on your injuries or rehab, injury prevention, check out jiu-jitsutherapist.com and shoot me a message on there, or proformrehab.com. I'd love to work with you guys, so reach out that way. And so thanks to Jonathan Amato, and here's the podcast. Thanks for coming on the podcast, man. I appreciate you taking the time. Welcome.
Sure, man. My pleasure. Yeah, I'm looking forward to it.
So now, Jonathan, you're a PT in New York. Tell me a little bit about kind of how you found yourself to be in New York, where you grew up, and those type of things.
Okay, yeah. I mean, I grew up on the east end of Long Island. Not quite the Hamptons, but I celebrated the Hamptons. I went to West Hampton Beach High School, so that counts. But yeah, I grew up out here my whole life. And then after college, I went to school for physical education, so I was a gym teacher for a couple of years. Couldn't get a job out here on Long Island, so then I moved to the city. I did the whole New York City Board of Ed thing, and I lived there for about 10 years. In that time, I left teaching. I got into being a PT aide and a strength coach at a facility in Midtown New York. While I was there, I played for a high-level rugby club. It was the Rugby Super League at the time. It was kind of the feeder league that fed into like the USA Rugby. Mm-hmm. And one of our sponsors was a PT clinic / gym in Midtown New York, and as part of their sponsorship, we got to work out there for free. So the owner saw me one day. He's like, what do you do for a living? He's like, I know rugby doesn't pay you that much, and it doesn't. I was like $100 a game, that kind of thing. If we're lucky, a flight stipend. So I was like, I'm a gym teacher, so I was there every day at like 3 o'clock. And he's like, why don't you get your CSCS? You seem to know what you're doing. Come work for me part time. Be like a strength coach for us here, maybe an aide for one of the PTs. So I did that. I was back in 2006. I got my CSCS. And then I started working for him part-time. Within like 3 months, I loved it. Like, I loved the whole PT world. I loved working with the people. And to be fair, that clinic is in Midtown New York. It had a lot of high-profile individuals, athletes, actors, the whole nine. So starstruck at first. I never thought I'd work with those kind of people before. So I left teaching. I did that for probably about 6 years. I was an aide to the head therapist there and the resident strength coach. And then it got to a point in time where I was about 30 years old. I'm like, all right, well, either I could be a personal trainer for the rest of my life, or I really wanted to open my own place. And I figured gyms open and fail kind of daily. And the business model that we had there was a physical therapy clinic that had a gym attached to it. So it was kind of a revolving door referral clinic. Yeah. People for the gym, if they got hurt, they went to PT. And people that came in off the street for PT were like, oh, there's a gym here. And they got like a discounted membership. So I thought that business model was really great. So I was like, well, maybe I could do this. So my options were go into business with a person who had their PT degree, and I'd be the other half of it, or I could just go back to school and get my own PT degree, and that's what I ended up doing. So I was there for about 10 years. I moved back out here about 4 years ago with my wife. We bought a house out in the middle of Long Island, so we've been out here for about 4 years now.
So what the interest initially in physical therapy was just kind of from your rugby background. Did you deal with any injuries growing up that kind of helped you kind of get a better understanding of physical therapy?
Yeah, more so, not really so much in high school. I mean, I wrestled all through high school and played football, but once I got to college and started playing rugby, I started seeing quite a few more injuries. I actually tore my ACL my senior year of college, so I had a full year of PT for that. And then obviously playing for the rugby team in the city, I had full access to this PT clinic. Every time I had a little bump or a bruise or an AC separation or bruised ribs or rolled ankle, I would go right to them for PT, and I loved the whole aspect of it. And to be honest with you, it was kind of a natural progression for me. I've always been involved in health and fitness since I was 13, 14 years old. So being like the physical education teacher into the strength coach trainer, and then it was just kind of this kind of snowball effect for me. It just kind of got bigger and bigger as the years went on.
What about like the PT world drew you in? Was there anything like, did you have a good experience with a therapist? Was it something they did hands-on wise, any kind of technique, skill work? What was that about? Strength and conditioning is one aspect, being that type of coach, but being a PT is a little bit different, quite a broader, more thorough understanding of the human anatomy and mobility and how the body works and functions. So what was kind of the interest there?
I'd say the big thing was the owner of that gym, Gary Guerrero, is probably one of the premier physical therapists in New York City. And to watch that guy work with his hands and like what he could do in 15, 20 minutes, a half hour with a person who came in like tremendous amounts of pain and walked out kind of floating I was awestruck. I mean, I saw it all the time. And then how he was a strength and conditioning guy himself, so how he wasn't your standard PT. People didn't come in and just get ice and stim for 20 minutes and then saw standard set of exercises. Everybody had like their own individualized program, and everybody got manual. Regardless of what happened, there was manual one-on-one for 20 minutes no matter what. And I just saw a huge effect from that. And just from start to finish, you're seeing how people come in almost crippled to like I said, floating out of there or going right back to their activity, whether it was the NFL or, baseball or just even weekend warriors. It was just, I liked the idea and I wanted to be that guy. Like I saw him help people and how much they loved him for it, and I wanted it to be me. It's kind of what it boiled down to.
So me being a PT, I have to wonder, what specifically did he do? Was there anything that you saw that he did manual-wise, any kind of training that he had that kind of made him stand apart from your day-to-day PT? Like you said, do your little straight leg raises, do your E-stim and ice and get out of here. What did he do different? Was it his demeanor? Was it his kind of thorough understanding of the individual? What were his kind of unique characteristics?
All of the above. The guy had an unbelievable knowledge of human anatomy, and he kind of created his own version of ART called, I think it was RMT, where it was just like, kind of like an active release type of technique, and having the patient actually move into the movement and have them actually get, some nice deep tissue, stripping the muscle, facilitating or inhibiting depending on what he had to have done. Mm-hmm. When I had PT for my own ACL, the PT looked at me for about maybe 5 minutes or so, and they did a little bit of scar mode, some patella mobilization, and then I was off doing my exercises where this guy really got in there, really moved the tissue, really moved things around, and just there was a purpose to what he did. Everybody didn't come in and just get an elbow to the glute. It was
right.
The reason why they were in there. He was manipulating, spinal structures. He was manipulating joints. He was incorporating some of the soft tissue work, combining things like ART and instrument-assisted soft tissue work in one session instead of just using one particular thing, which was awesome to me.
So describe for somebody what ART is. If somebody's not familiar with that, or any kind of like just general your day-to-day, if there's an athlete that's listening to this right now and they're like, well, I want to seek out ART, what is that and what can they expect from ART treatment?
Kind of like a pin and stretch type of thing. So if you have a trigger point, let's say in your trap, the therapist would actually press down on that trigger point. You would move actively against the range of motion with that muscle. He would cause the muscle then to relax with his active pressure in the area. So depending on what muscle you had that was, either over-facilitated or inhibited, you can either treat one of those based on, movement for the most part. That's the best way to look at it.
So essentially you're kind of turning certain muscles on and turning certain muscles off by way of kind of, contract, relax, and manual therapy technique, just for kind of people that need to understand. Exactly. So, and is there a certain type of training that he did for that kind of a specific, or is that something he said he developed himself?
I'm sure he took, I don't want to, put words in the guy's mouth. I'm sure he took an ART course, and then from that he developed his own kind of branch of it. So
awesome.
He tweaked it to his own liking a little bit and made adjustments on how he saw fit.
So, let's get back a little bit. As far as your strength and conditioning background, what kind of things did you do or work with that kind of led to you to PT? Did you start working with some athletes in the clinic? Is that kind of initially what you saw, and then you kind of wanted to take a little further route, towards the PT?
Exactly. So what would happen is that guy Gary would work on them for their 15 or half hour or so manual, and then it got to the point where he trusted me enough where he would then hand them off to me, and I would create their entire protocol. So from start to finish of, base strength to power to explosive power to then obviously sport-specific exercises based on whatever they were doing. If it was football or basketball or ballet. We worked with a lot of the prima ballerinas in New York. And everything was just drastically different. So it was never the same from one person to the other. That's what I liked about it. I liked the variability of being able to work with the different athletes and being able to tailor their program, the end stage of it, towards their, back to sport or back to performance activity.
So how would you tailor? Let's give an example. You've got a wrestler or a college wrestler. and you got a ballerina. So they're getting close to, getting back to sport. What kind of things are you working on for return to sport for a ballerina versus, a wrestler or an MMA fighter or, anybody like that?
So you look at your ballerina, and obviously they are very fluid in their movements. They're very flexible. They're very mobile. You want to actually help them to maintain that. But you want to make sure they're strong in that range. So a lot of problem that you see with ballerinas is that, yes, they're very mobile, but at the end range of everything they're moving in, they lack strength somewhere. Somewhere in the chain, something's broken. Something's not strong enough. So teasing out what that is and keeping that range of motion they need to be able to perform properly, making sure they have as much strength as possible without compromising their mobility. That's kind of where the fun comes in with the ballerinas. Flip side of that, with your MMA guys and your wrestlers, they're very explosive. So towards the end of their treatment protocol, you'd be working on a lot more explosive power, quick change of direction, quick step stuff, multi-directional, transverse plane, frontal plane, sequencing both of those into a movement possibly, or movement specific, working on like shot drills with resistance, or striking drills with resistance, rotational aspect stuff that they would see in the fight game, and that would carry over to their striking coach or their grappling coach.
So based on the type of fighter they were, if they're more of a wrestler, more of a kickboxer, do you tailor your rehab towards that, kind of what they would do more of in a fight?
Sometimes. So then of course it comes down to how are they there? Are they there out of pocket so they can come as much as they want to?
Yeah.
Are they there under insurance so they're limited to the amount of resources they have, so the amount of visits they get is limited. So it depends on how far we can get in the treatment process. A lot of the higher end guys we see come out of pocket. Well, let's say if it's a UFC fighter, if they were hurt in a fight, the UFC covers their rehab until they're back to fighting shape. So depends on the level at which they're there. So I'm trying to think of an example for you. So if it's more of a wrestler, then we would work on more explosive power stuff, glute dominant stuff, glute and hip dominant.
Sure.
And then if it's a striker, it's more quad stuff, more the single leg stance, making sure they have strength in order to throw that kick off the front foot, whatever it is. It really varies. So we leave a lot of that to their individual strength coaches in their facility or their striking coaches. We try to make sure they have a good base going forward. We'd love to be able to take them all the way through, which is kind of our plan in the future. But for now, we're kind of locked into the PT. We get into a little bit of strength and conditioning, and then we kind of hand them off to their individual strength coaches.
Got it. How does that handoff occur? Are they there with the training, like during the PT kind of, are they sometimes disagreements or like differences of opinion on where you should be taking them? How do you deal with those type of things?
That does happen. Fortunately not for us. The guys that we work with kind of hand in hand, my colleague, Mike Camp, has cultivated really good relationships with those guys. So we have Keith Trimble from Belmore Kickboxing, Belmore MMA. We've got Tony Ricci, who works out of the Longo Weidman camp. He's their strength coach. They're all really good friends with my colleague Mike, and they trust everything we say and or do. So all we do is just have a quick conversation. Hey, this guy's here. Progress him on, with this sort of protocol, whether it's strength or power, or get right back into fight performance stuff, and they can kind of just carry on from there. So
as far as let's talk a little bit about like trends in BJJ or MMA. What are you seeing now in your clinic? Guys that are injured. What kind of injuries do you see? Even guys before they even get to the fight. Like, what are you seeing as far as injury wise, and what are a lot of things that you're working on?
Lately, actually, I've been noticing a lot of LCL, MCL injuries. I'm getting a lot of that with my BJJ guys, a lot of my judo guys. There's mixed martial arts in general. I've actually got 4 right now that are dealing with either LCL or MCL. It's kind of an uptick right now. Typically, it's more shoulder-related stuff we tend to get. But a lot of it is these guys come to us even when they're at 100%. Fighters are never 100%. They're maybe 90 at best. So a lot of it's just dealing with maybe some niggling injuries. They've got they've had a deep thigh contusion. They didn't really work out properly, so now they're lacking that power in that quad. So helping them get that back to reinforce their kick, or the range of motion in their shoulders from tweaking their labrum, or the rotator cuff never really came back 100%. So really working on joint mobility, making sure they have that. But as far as the injuries that I'm noticing now. It's like I say, it's a lot more knee ligament injuries than anything else.
What's kind of the mechanism of injury for a lot of those? What are you seeing? I mean, I know with jiu-jitsu wise, myself being a jiu-jitsu practitioner, some of these positions, some of these leg lock game being evolved, in a lot of these positions, different guard positions that are put some torque and stress on the knees, on the ligaments. Is that some of the things you're seeing? Is it from leg kicks? Is it from takedowns, shots? Where are you seeing a lot of these? What are the mechanisms of injury?
About 20% or so from takedowns, all the stand-up. So just wrong place, wrong time. They got kind of locked on the mat. The guy got driven forward, driven back with a varus or valgus force that the knee just couldn't handle. But I've actually had probably like 6 in the last year from lasso.
Lasso guard, yeah.
Lasso guard. So it's actually been a big thing I've been noticing is the lasso has been producing a lot of ligament injuries.
So the guy that's playing the lasso, the guy that's doing the weaving, like the leg in. So what do you do as far as going about a recovery? Give me a little bit of from maybe like a grade 2, so like a partial tear, maybe MCL, or because MCL, a lot of times not surgical. Usually it kind of scars down, heals up. So say you've got like a partial tear, MCL, so the inside of the knee. What are some things that you like to do as far as recovery wise? Maybe 2 weeks out, 4 weeks out, 2 months out.
Sure. So if we get them right away, obviously it's reduce swelling, reduce pain as fast as possible. Now whether that's use of rock tape for some of the edema taping to help pull some of the swelling out. If it is the Normatec compression system, we've been using a lot more to help get some more of the swelling out. If it's manual lymph drainage or whatever it is to help kind of reduce that swelling, reduce the pain, that's usually like ground zero. That's what we're working on first. And then from there, I actually utilize a lot of instrument-assisted soft tissue stuff. So I'll actually use the grasping tools and I'll gently kind of strum the MCL itself to try to bring some more blood flow to the area. Mm-hmm. That's usually like around like the 2-week mark or so. And then from there, we'll start doing some functional re-ed stuff with, have you heard of a Compex unit, like a muscle stimulator?
Yes, yeah.
We use that more so than the Russian.
So that's more for muscle activation, just like for getting that muscle to fire. Have you found that to be really effective? Do you like that?
I that over the Russian stim.
Because that stuff's like, the Russian stim, you can't really, I guess maybe you can, but a lot of times these big E-stim units, you can't even get those. So like this is stuff that's out there. The Compex units are out there. Like anybody can buy those things.
Right. And they're fairly cheap. I know they run sales during the CrossFit Games, and depending on who won Mr. Olympia, like Ronnie, I forget who won the last one. But when he won it, they had like a 40 or 50% off sale. So you can get your hands on a unit for like $120. And you can have multiple ones of these in the clinic, and they're very mobile. They're small. They're size of like cards, and you can get them going. So I like the contraction with those is way more comfortable than with the typical Russian biphasic stim. The sawtooth pattern, whatever it is, there's way more comfort in the contraction. You can get a deeper contraction of the muscle without that stinging pain a lot of guys get with the Russian.
Right.
And then they're able to work through whatever the range of motion is. If you're doing open chain extensions, if you're having to do body weight squats with it, they're getting a better contraction with it. They end up being fairly sore from it. They like the results they get out of it.
So you kind of get them, you coordinate like the contraction with, like, say they're doing a squat and you put it on their quads. So while it's on the off phase, they're kind of sitting, or like maybe they're doing box squats or sitting down. When that Compex unit when it turns on, engages that quad, they're standing up.
Yeah, we usually get them to do. I think the resistance phase has like I think it's about a 4 or 5 second contraction period. So about 3 or 4 body weight squats in that period, or extension depending on what you're trying to do. But
okay, gotcha.
Usually about 4 reps or so, and then either they're standing or sitting in between for their little rest period, and we take them through the whole program, which is roughly 10 minutes.
Gotcha. So you named a couple of things: KT tape, Normatec, the instrument assisted soft tissue massage. And then you said that the Compex. What do you find all those are, because those are kind of readily available now. Do you like, so let's talk about the Normatec, which is like a compression basically to get some swelling, sometimes get inflammation out, help with kind of muscle recovery. They claim that, it helps with lactic acid, getting the lactic acid out, I guess. So how do you feel like it works, and do you feel like it's very effective?
Well, I know what it does. It works on the peristaltic contractions. So it starts from distal, works from proximal, which is what you need from lymphatic drainage. So the theory behind it is, and I've been getting a lot of conflicting evidence on whether or not ice is good for reduction in swelling. Because obviously it causes vasoconstriction. So if you decrease blood flow, is that necessarily good for the area? No, probably not. But it's great for pain. Where the Normatec comes in compared to like a Game Ready, let's say, that has like the ice component attached to it,
right?
Is getting just the compression, so you're pushing a lot of the swelling out of the joint space. If it's a muscle recovery issue, say there's like a really bad set of DOMs going on, they're really sore, or post-workout for recovery, clear all that like kind of metabolic waste out of the area.
Right.
It's really well. We get a lot of good feedback from our patients out of it. They seem to really like it. A lot of our athletes come in. We actually do like an a la carte thing at our place where people can come in off the street and just use a Normatec for 20 minutes, just for recovery stuff.
Right, and that's something I've actually looked at, because I work with some guys at my gym, and I've got kind of my own little private practice that I see people out of, and that's definitely something that I've looked into. I've done the research. Again, there's some stuff that's not, the research isn't all that great, but the feedback you get, whether it's placebo, whether it's whatever it is, the theory behind it makes sense, and also I feel like you got to take people's response to it into account, how people actually feel. And a lot of them feel a lot better. They feel kind of almost like their legs feel rejuvenated, so it seems like it's got, if I had the choice of not doing it versus doing it and I'm an athlete, I'm going to do it every time, even if I think it's going to help me,
These guys do whatever it takes. And it just boils down to like the 3 pillars of evidence-based practice, right? So you have your research that tells you one thing about a certain modality or piece of equipment. Then you have your clinical expertise or your knowledge. So what you've seen over your time in practice as to what works, what doesn't. And then you have your patient buy-in or your patient expectation.
Sure.
So to me, as long as you're meeting 2 of those, you're going to get a good outcome.
100%.
The biggest thing is patient buy-in or patient expectation. If they think it's going to work, even if it on the biophysical level, it's not actually, but psychosocially it is for them, then it's going to aid in their rehab. So to me, if a person comes in asking for it, even though it may be something I might not have in my plan, I might see if I can squeeze it in somewhere for them just to have more patient buy-in.
100%, yeah.
Instead, there are certain things that I don't care who asks for it, I'm just not doing it because I don't think it works, such as like, ultrasound has been proven to do almost nothing these days. So people that used to get ultrasound for ankle sprains still want it. I just don't do it because it doesn't do anything.
Right. Yeah, I mean, but again, for them, maybe it has an effect. I've used it before in the clinic, and people are like, oh, I feel great. And I'm like, I'm just rubbing this wand over your shoulder, and it's probably not doing anything. But, again, even somebody comes into your, to your clinic, and you put your hands on them, and you touch to where it hurts, or you do some kind of, mobilization, anything, and they will feel better. It's just, a lot of that is like you said, the psychosocial kind of component. That's huge. It's huge.
The biggest thing you said there is the manual, man. That's what everything that our practice is built on is you got to put your hands on the patient. You got to feel how things are moving, what's restricted, what's over facilitated, and then actually adjust and manipulate, and then put them in a better position to perform.
Exactly.
Is soft tissue the answer? No, but it puts them in a good space to then go ahead and do their Therex properly or their performance.
No, I agree 100%. I think, the people, there's people out there that are like, oh, well, you're just doing passive modalities or passive therapy, and that's not as effective as, actual functional strengthening or exercise and things like that, movement, patterns. And I think that, it's a combination of the two, and also it's a variation of how much each person wants or is best for their outcomes.
Right, and there's that balancing act of people that come in thinking they're just going to have a massage for 20 minutes and they're going to go, and you got to make sure that you meet their expectations, but also let them know the reasoning behind what you're doing and why it works.
Right. Yeah, and that's a huge thing, patient education right there, you being a teacher before, that's a huge thing too, education-wise, you're at to educate, so as part of, learning and teaching, getting people to buy in, I think is huge. So
it helps having that little teacher's background. It's definitely helps out with understanding, or even just being able to speak in terms that they understand. We get so caught up in talking to each other, other people, other colleagues in the medical profession, and using certain jargon, but most patients don't care about the technical term or something. They just want to know what's happening, why is it going to work, and how can I get better. So if you in terms they're going to understand, you get more buy-in that way.
Right. Yeah, I always go back to this, like thinking about when I was at school, I wish I had more education on like psychology of like people, getting them to, because a huge thing is buy-in, getting them to believe in what you're doing. And you can do certain things and make certain changes in the clinic for, 45 minutes to an hour, but then they have, maybe they see you once or twice a week. That's 2 hours out of an entire week. There's all this other time throughout the week that they're maybe not doing the correct stuff. And so that's going to make your what you do in the clinic not as effective. So that's where buy-in comes in 100%, Yeah, I mean, is there anything like anything that you do to get, obviously with athletes, I think buy-in may be a little easier, possibly not. I mean, what do you feel, how do they change, like, how do they vary from like your regular everyday person as far as like you telling them to do stuff? Do they do it over the top, or some of them don't do it at all? How do you feel like those elite level athletes, UFC fighters, respond to kind of your instruction?
A lot of it with those guys. So there's, with your everyday Joe, you're kind of just trying to get them functional again, right? There's ways that they, get out of bed without pain, get up and down stairs without pain, brush your teeth, maybe go to the gym a couple times a week and with minimal or no pain. With these guys, they're always in pain, and they tend to overtrain. So a lot of it is actually getting them dialed back a bit, allowing that recovery process to happen, and have them buy into the fact that what you're doing requires certain recovery and time. They're not going to get fixed in 2 sessions. Sometimes they get this really good effect after a session or 2, but a lot of it is just actually getting them to dial it back, cut one of their 3 training sessions a day out so they get a little more rest and recovery.
So where do you come in as far as, if somebody's in a training? Let's do a couple different scenarios. One is a guy sees you, a UFC fighter sees you for maintenance. They're training for a fight. They're out. They're in training camp early on or something. Maybe they're a couple weeks in. Fight's 6 weeks away. What's your role in that case versus you're maybe a couple weeks out of the fight? How do you vary your role in their training camp?
So a lot of what we do now is, especially with these guys in their camp early on, it's more just, like you said, soft tissue maintenance, making sure things are flowing properly, joint mobility is good, they don't have any real tissue restriction in different musculature that's going to cause a problem later on.
Right.
So it might be something as simple as just they come in and we'll do some soft tissue work, maybe some instrument-assisted work. We'll give them a couple corrective exercises if they need it, and then they go off and they do their own thing. Towards the end, it's more helping with the end stage recovery, because a lot of them are cutting weight at that point in time. So they're getting real dry, they're getting real sucked out, they're starting to see some real tissue restriction. So it's working on, again, increasing that tissue extensibility and making sure that they can move properly.
So what are you doing at that point? Like what kind of tools are you using, or skills are you using if their tissue's kind of, they're losing a lot of that really the extensibility and the mobility in their tissue. They're a lot more probably prone to injury. They're maybe more stiff and not quite as, obviously they feel shitty because their diet's restricted and their calories are restricted and their water is restricted, So what are you doing at that point?
At that point, we kind of steer clear of more of the instrument-assisted stuff because you don't want to cause more tissue breakdown,
right.
Which you can do with instrument-assisted stuff, but you don't necessarily have to. Nor should you at all times, but we're trying to steer clear of that. We go more towards, my colleague and I are trained under this French osteopath. So a lot of our manual work is more to the side of osteopathy than physical therapy. So a lot of joint thing, making sure there's enough fluid getting to the joint, a lot of synovial fluid to feed the joint, make sure it's plenty of nutrition, moves well. There's another transverse tendinous ligament stretching we do just to make sure like the Golgi tendon organs are being stimulated enough to allow the contraction to happen. So more of those sort of things for optimizing their movement.
Right.
Stay away from any sort of tissue breakdown if possible.
Okay. So now as far as treating, say you got an athlete that is, again, training for, a UFC fighter, training for a fight, and they're injured. So let's say they're dealing with an injury. How do you go about that? How do you go about reeling them in or even making a decision for them maybe not to fight? Is there certain aspects that you're kind of weighing at that point?
Luckily, I have not personally bumped into that yet, where a guy's been so injured that he has to even question whether or not he can go through on his fight. Obviously, in any fight camp, you're going to have little hiccups here and there, like you took a shot too hard to the quad, and now you've got a little deep, thigh contusion, sure. Or you rolled your ankle too hard, too much when you were trying to strafe for a kick. So it's really just mitigating those things, making sure they're not too bad. In a few of the camps, we've had a couple guys that had some things that could have gone awry, but we caught it early enough where we were able to work it out and have them continue their normal camp. It all depends, really. It's hard to say because each case is different. Each injury is different. Each guy is different, guy or girl. We got a few female fighters coming through the camp now these days. Some of them are tough as nails too. So it's kind of really reeling them in and getting them to recover properly. Now, whether that's making sure they either have a complex recovery unit for them to do at home at night at the end of the day to really pump the lactic acid out, or that they're doing Epsom salt baths, or proper hydration, which is where a lot of nutritionists come in. But if we talk with them, like case in point, Tony Ricci's a really great nutritionist. We'll chat with him and say, we noticed that this fighter's tissue seems a little more bogged down, or it's a little more strict than usual. What's his water intake like these days? Can he get a little more in? Are his electrolytes up to status quo? And maybe he can tweak it on that end so that we start to see a bit difference in tissue quality maybe in like a week or so.
Yeah. So, I mean, what do you feel like as far as if there's a therapist listening, like what kind of things do you think as far as continuing education wise, if somebody wants to deal or treat with this population, what do you say, like if you're a new grad and your goal is to work with athletes, UFC fighters, whatever it is, what would you say, take these classes or learn these things? What would you recommend?
That's a loaded question. There's a lot of them actually, and I'll start off with the caveat is, take as much as you can, but go into them with a healthy dose of skepticism. Because if you go to one of these things like a rock tape or a Graston, the people that give these instructions for these courses, they're very enthusiastic.
Sure. And
they like to make you think that technique is the cure-all for everything. And that's just patently untrue. Obviously, there's certain things that qualify and certain things that don't. So if you go in there with a healthy dose of skepticism, then you come out of that with kind of a few tidbits. So you get a little bit from the Graston, you take a little bit from rock tape, you take a little bit from a cupping course. You're able to put it together into your own style. That's when you start to see really good results. Mm-hmm. Things that you try it on yourself and you see what you like and what you don't. But as far as like must-do courses, obviously anything manual, manipulative, like Maitland courses. Learn your spinal manipulations and mobilizations down pat because they're key. Joint mobilizations, manipulations. Like I said, my colleague and I take a lot of courses from this French osteopath that comes over to the States probably 2 or 3 times a year. It's this whole sequence we do. If you can find things like that are obscure but that really work, it'll help set you apart from other people. Because everybody and their mother wants to take a Graston course and a cupping course and rock tape or KT tape. You got to find things that are very effective but that aren't very well known possibly.
Yeah. So what, and that osteopath that you take courses from, what kind of things is he doing or teaching you, that maybe are different?
Fascial normalization and manipulation, which is getting more of a buzzword here in the States. But this guy, his name is Guy Voyer. He kind of pioneered the whole fascial manipulation thing. He can treat patients for pericardial infections via soft tissue and fascia in the thorax and
really?
Things way above my pay grade, if you ask me. But he teaches you these things, and it's from head to toe in each course. Like I said, fascial mobilization and normalization. There's the transverse tendinous ligament stretching. There's joint pumping for all the different joints in the body, making sure you actually use muscle contraction and blocking with the joint itself to perfuse the joint with synovial fluid to make sure it's healthy. Mm-hmm. Things that you don't get in the standard PT, CEU, or PT course, at least as far that I've come across. I know there's a lot out there now with like the FRC stuff, where Dr. Andrea Spina's got a lot of things out there that seem to work. The pails and rails and the cars seem to be big. They seem very osteopathic to me, so maybe they're along that lines. But yeah, it's looking for things that like are interesting to you, obviously, and then that way you can fit them into your treatment process.
Right.
And that's what I think is big, to set yourself apart from everybody else, because there are so many PTs out there. Now, granted, the manual side of therapy may be, I don't want to say dying, but it's not as big as it used to be. So I like to think that people are trying to bring it back, which is nice, like my colleague and myself. But everybody, guys that are personal trainers can take a rock tape course, or take a blading course through rock tape. So you got to do something that these guys, that nobody else can do except for somebody specifically in your field. So it makes things a little more obscure and sought after, really.
Yeah, so kind of you set yourself apart a little bit from these people. Yeah, I mean, it kind of it makes sense. It's kind of everybody kind of does a lot of these things, a lot of these same things. Like you said, the FRC, courses seem interesting. Yeah, I mean, it's just whatever. I know there's trends and stuff. Is there any trends in PT that you're seeing right now that you, like you said, you're seeing manual kind of come back a little bit? Any other trends that you see coming up that may be effective that people should kind of look into?
Yeah, and I guess it's a trend, but people are starting to shy away from some of the passive modalities, like just putting the patient on stim and heat
right.
for 10 minutes. They're really getting away from that. We only do that if you need it. We don't do it for every patient. It's if there's pain or there's restriction or swelling, we'll use some sort of modality like that. But I think the passive modality trend is starting to go away. At least on my end, and maybe I'm just biased because we don't do it per se. But I think that's definitely coming up there. And more of the manual stuff is coming about, even though, a lot of the evidence is showing that if you can make a patient more self-reliant, not relying on the PT for the manual stuff, it's more beneficial for the patient in the long run. So some PTs are shying away from the manual stuff. But again, there's camps for everything, right? So you have your one camp of PT that loves their manual, like myself. You have your other camp of PT that's really all about Therex and Therex only, which is good too.
Right.
I think a healthy mix is kind of the best.
How do you kind of get people to buy into maintenance? That's a big thing. Maintenance physical therapy guys or athletes that come in or don't have any issues or nothing visible. Like, what do you do to get them to buy in? Do you do like a functional movement screen, like a selective functional movement assessment? Like, do you try to promote that and get people to buy in? Because for my end as a PT, a lot of people don't have. To the regular person, don't have any kind of glaring issues, but you take them through some of these screens and you can see some dysfunction in there that could lead to problems. Is that something that you do with a lot of these athletes, or even just in general, have people come in and do some of these screens for preventive measures?
We do. We offer it. My colleagues, SFMA, I take the FMS. We have a lot of these pre-screen things we can do. Unfortunately, people don't take advantage of it as much because a lot of people wait until it's too late to kind of take care of anything. They wait until they have the pain. And insurance doesn't cover it. So, your insurance doesn't cover prehab. They're not going to cover preventative screening. They wait until you're actually injured to do anything. So, unfortunately, I don't see much of it. But we do those things. As far as getting a fighter or a patient to buy into the maintenance of the PT, you can equate it to their fight game. So if you don't consistently work on your striking, you're going to fall behind a bit. If you don't consistently work on your grappling, you're going to fall behind a bit. If you don't consistently work on whatever exercises we gave you to prevent said injury, it may come up real fast on you. So if you put it in terms like that, these fighters seem to get it because they put the time in for striking 4 or 5 times a week, grappling 3, 4, 5 times a week, strength training 2, 3 times a week, cardio 3, 4 times a week. Mm-hmm. If you can get them, maybe not even take away from one of those, dial one back a bit and add their prehab work, it'll just keep them progressing forward to the point where maybe they don't have to come into you for an actual injury for this particular fight camp or anytime in the future.
Yeah. Is there any things that you like to prescribe? Like, for example, and there's some differing opinions on these things, like foam rolling. Is that something that you prescribe to athletes or to your clients or patients? I mean, how do you feel about foam rolling? Because there's been some foam rolling, kind of the tampering, kind of the deep pressure, things like that. Do you think that's pretty effective stuff?
It does particularly like piriformis foam rolling. We do a lot for low back patients. If that sucker's real tight, pelvis isn't moving properly, it can cause some malfunction in the low back area. So if you can keep the piriformis fairly healthy and fairly mobile, you might help in decreasing instance of low back pain. So we do use that a lot for a lot of our low back patients. As far as like rolling out your IT band, that sort of thing. I mean, you took a cadaver class, right? My anatomy professor actually cut out the IT band and he tacked it to a tree and he tied a weight to it. And he showed us that this thing isn't moving anywhere. It's basically a piece of steel. So are you really elongating your IT band? No. But what you're doing is when you roll out like the TFL and the glute med and the glute max, the muscles that it arises from are getting more suppleness to them, more extensibility. Therefore, in turn, the tension on the IT band might decrease a bit.
Right.
Actually, depending on what your goal is, right? So if your goal is if you have a tight IT band, like a positive noble compression test, right? They got some lateral knee pain. Roll out the IT band itself, probably going to waste their time. Hit the structures that it arises from, might see some significant difference. So it all depends.
Right. Yeah. And yeah, people, there's some differing opinions on how it works and why it works. And for me personally, when I kind of foam roll, I think it just kind of something with helping with just getting the tissue. It almost gives some feedback to your brain. There's something about the feedback that it gives you.
It's just exactly what it is. You're waking up those mechanoreceptors. You're waking up the Ruffini endings in the muscle. You're making everything more responsive for the CNS. Are you actually elongating a muscle or increasing its extensibility? Maybe not, but neurologically something's happening.
Right.
I can't myself either, but.
Well, what do you feel like? And I know these are some questions that are out there. We can kind of end with a few of these. Stretching before exercise versus after exercise. Do you think stretching is effective? What do you prescribe as a warm up to an athlete versus a cool down?
Dynamic stuff. I'm not a huge fan of static stretching. A lot of the research shows it actually can lead to actual injury. So if you create too much length in a tissue before performance, you could suscept it to maybe more injury. So activity and motions that mimic what you're going to be doing at a slower pace, more dynamic, is definitely the way to go. That's what we do with a lot of our athletes. And then afterwards, there's nothing wrong with some light static stretching just to help make them feel good. But in terms of, are you actually lengthening a muscle with some static stretching? Probably not. Nobody holds it long enough. Nobody pushes hard enough to actually cause a plastic change in the muscle. You're just kind of working on that elastic range itself. So post-exercise, post-workout, little static stuff just to kind of make you feel good, sure. I never, ever do static before a competition, before performance of any kind. I just don't like it.
Right. 100%. Yeah, I agree with you for sure. And there's been research that shows if you do a static, so for people that don't know, like a dynamic's more of like a shorter hold time, maybe like 5-10 seconds, or getting into a movement or actually moving.
Like swings or stuff like that,
right.
Kicks, those sort of things, definitely.
Right. And then when you look at static, I guess they say like 30 to 60 seconds, something like that. I don't know if those are exact numbers, but they did show, power-wise or strength-wise, if you do a static hold, you're actually going to not be able to produce as much power. So that's another thing. If you're in a sport that's explosive, or you have to produce, powerful movements, explosive movements like MMA or some other things, rugby or whatever else, then doing a static, long, prolonged hold is not indicated. But afterwards, I think as a cool down, they say, and I'm not sure if this is 100% correct, but there's some pain components. It may relieve some pain, things like that with longer hold times. And that's after. And I 100% agree with what you said. Dynamic stretching before, movement type stretches, kind of getting into the restricted movement and coming out of it repetitively. And then, at the end, you can do some static holds if you want, some yoga poses, things like that. So, I agree. I agree with that. So, is there a type of protocol that you follow in general, strength training? Is there if somebody's a jiu-jitsu guy or whatever, or anybody, do you recommend a certain amount of days of strength training to get benefit? Is there a certain breakdown that you like of strength training? On days maybe you're not doing jiu-jitsu, like so somebody trains jiu-jitsu, what would you prescribe to them if you're trying to build some strength, power, things like that?
So at least 2 days a week is some strength training. A lot of the jiu-jitsu guys are afraid of getting too big, afraid of soreness in the muscle, decreasing their range of motion, decreasing their ability to move. But you got to strength train in order to keep those muscles healthy. Otherwise, you're going to set yourself to some sort of injury later on.
Sure.
Now, as far as the reps and sets kind of go, for those kind of guys, general strength protocol stuff, right? So like 3 or 4 sets of like 6 to 12 reps, anywhere in that range, 75, 80%, 1 rep max maybe, depending on what they're looking to go for. Obviously, if you're looking to go for power, it's significantly different. You increase the load, decrease volume, increase the actual 1 rep max percentage. But it depends on how far out there from competition, right? So if they're in off season and they've got 3 or 4 months before competition, you might actually add a week or 2 or 3 week block of power training or explosive power training for them in that off season training camp. But you got to be careful it's not too close to any kind of competition. If they have some sort of jiu-jitsu tournament coming up, then maybe more maintenance stuff, higher rep, lower weight, good range of motion, contract, relax, contract, hold stuff. Time retention is huge for those guys because, in a jiu-jitsu match, you're 5 minutes straight, you're just busting your butt. Every muscle's firing at all times. Right. So you want to get yourself ready for that. But like any other sport, if you do one thing too much without any sort of cross training, you're going to open yourself up to potential injury. Like runners who don't weight train, they've got to. A lot of runners are coming around now to doing at least 1 to 2 days a week of strength training. So the same goes for jiu-jitsu, really.
Yeah, that's one thing. I do treat some guys from the gym, and I tell them all the time, you don't want it to overpower. Like, you don't want your strength training to completely, encapsulate everything you do, but it's a great adjunct to jiu-jitsu training. Everybody knows jiu-jitsu players rounded, closed in. So opening up, working the posterior chain, the hips, deadlift, squats, you can't go wrong with that kind of stuff. Postural type things, postural corrective exercise are huge. Just because, I give this example a lot. We have a guy at the gym, younger guy in his early 20s, a good buddy of mine, and he is just a beast, and he beats everybody's ass. I mean, he's awesome. He's phenomenal. But looking at him, he's kind of a thinner guy, not physically imposing, and he's been dealing with some injuries of late. And I'm like, man, you have to start, taking care of your body. You can't just train jiu-jitsu 5, 6, 7 days a week, two times a day, and your body's going to break down. You're just putting more miles on your body. And that's where strength training comes in. And that doesn't have to be strength training all the time. You can add yoga and things like that. There's a lot of different stuff to add.
Any variations of kind of cross-training, add a HIIT training session with an aerodyne bike once or twice a week. Just something to change it up a little bit.
Right.
Take the constant stress of jiu-jitsu off the body for a day or two a week. Nothing crazy.
Yeah, I think a recovery day or an active recovery day, just because you're doing a recovery, it does not mean you have to sit on your ass and do nothing.
Recovery is a good word, yeah.
Go do some walking, a light walk, some yoga poses, whatever it is, some light stretching even is fine, on those days that you're taking it easy. Don't just do nothing, because your body will kind of just, I feel if I take a rest day and I don't do anything, I feel like shit the next day. I feel sluggish. I feel tired. My body doesn't feel like it's woken up. So
those might be your days, like, 1 day a week to work on, like, meditation, let's say. It's becoming bigger now, or, mindfulness, whatever you want to call it. It's like something that you're doing something to improve your overall self, but not necessarily physically, right?
Right.
Sometimes that 7 day a week, even if it's an active recovery day, might be too much. So, like, one thing I've learned in my career with strength and conditioning, and now with PT, like, the rest and recovery is just as important, if not more so, than the actual work. If you're not sleeping right, if you're not eating right, if you're not taking the breaks when needed, you're going to break down so much faster. And a lot of these guys don't get that. They think more, push. I got to work on my striking. I got to work on my cardio. I got 6 weeks to get better. Sometimes they go overboard and they end up taking a back seat, and they get hurt before competition, and then they're out.
Well, and their performance suffers too. Like they go out to to the fight, and they don't have that explosiveness. They don't have that punch, that drive, that step that you need, and if you just can't, some guys you'll see they'll have bad performances, and you're like, what were they doing? They just couldn't. They couldn't pull the trigger. They couldn't do that, and that's overtraining.
It's overtraining. And I know that term gets thrown a lot lately, especially in the fitness world. Everybody's worried about overtraining. It's really hard to do, to really overtrain. But what I've noticed a lot with these MMA guys is, if anybody's going to do it, it's probably them. Like, they tend to go too much.
Well, yeah, you bring up a good point. It may not necessarily be overtraining, but it's like when you're at that fight, I mean, it's a game of inches, man. I mean, like, you make one mistake and then that could be it. You don't get out of the way enough, or you don't block enough, get your arm up, and I mean, that could be a knockout. So that's like, it may not be necessarily overtraining, but they may not be as sharp as they should be. And at that point, when you're at the UFC and you're at, like, freaking championship level fights, and I mean, that's that little bit could be the end.
It's huge.
Yeah.
That's why a lot of stuff's coming about with, like, the recovery stuff. It's become a bigger aspect of all sports, in particular with MMA guys. Whether it's ice baths, or if it's Epsom salt baths, or float space stuff, or the cryotherapy is getting bigger, more and more play now. That I don't necessarily buy into it for the most part, but there's more things out there now, and guys are buying into the whole recovery and rest thing to kind of complete the package for everything they got going on. So you got your nutrition, you got your strength and conditioning, you got your striking, your grappling, you got your recovery. So that's now another pillar to, like, your camp, and it has to happen.
Yeah, I think people don't realize the importance of recovery because because you feel like you're not doing something. You should be doing something to continue to push your body. But they don't realize that taking that just rest day or that break or that, like you said, that meditation time is going to pay dividends long term and kind of help you get to that, to that peak to where you're getting ready to be at your top level. It's going to get you there and hopefully keep you there at the right time, so you can perform. So, yeah, awesome, man. Yeah. Oh, so Jonathan, if that's all I've got, brother. Is there any, if somebody wants to get a hold of you, if they have questions, if they want to reach out to you, how can they do that?
Yep. The website for our clinic is www.strengthandrehab.com. My email is Jon, Jon, @strengthandrehab.com. My Instagram handle is dr.amato_PT. So it's Dr. Amato PT. That's my Instagram. And those are really the two big things I use. I'm not really a big Facebook guy. I'm on Twitter, but not enough to really make a difference. Instagram's kind of the big one. Bethpage PT is the clinic's Instagram handle. But those two things are kind of the easiest way to get a hold of either email or through the Instagram itself.
Awesome, man. And you're based out of New York, correct?
Yep. We're Middle Island, Long Island, New York. So we're probably about 45 minutes outside of Manhattan. So we're kind of central location. Anybody in the tri-state area, New York, New Jersey, Connecticut, we get a lot of guys that come from there, depending on what they're trying to do. East end of Long Island. So we see a good side of the Northeast for the most part, which is good.
That's awesome, man. Well, I appreciate it, man. Thank you for your time. Best of luck. And I hope I hope everything goes well for you, and hopefully we'll talk again soon.
Thanks, man. Appreciate it.
All right, brother. Appreciate your time.
And that's it for the podcast, everybody. Thank you again to my guest, Dr. Jonathan Amato. Make sure to follow him on Instagram. If you guys have any questions for me, shoot me a message at jiu-jitsutherapist.com. I appreciate if you guys leave me some reviews on iTunes. It helps me grow the podcast. Thank you to our sponsor, Defense Soap. Check them out at defensesoap.com. And I'll see you guys for another podcast next time.